Well, good afternoon.
Good afternoon.
I have to start today with a little bit of a funny story. I noticed that I left without my ring. I'm married, and whenever I do that, I'm going to be on camera, so I better explain to my wife why. I was washing my hands, and I was thinking of a funny thing that happened the other day. And y'all familiar with Chinese finger puzzle?
Yes.
Okay, so I asked my wife to order a big bundle of those for a presentation I'm doing in a couple of months. And she's Indonesian, so she has an accent. And she's sitting next to me, and she got the email on her phone, and she said, "Why you send me the finger?" I think I laughed 10 minutes. Great. Called my mom, laughed 10 more minutes. So it was just a funny thing. A not so funny subject is the impact of stress and anxiety in our culture, in our world, and as it manifests in different pathologies of ill health. There's wide acceptance in the medical community, in the alternative medical community, that stress and anxiety is the root cause to just about, just about everything we have a name for. Think about that for a moment. Are we treating the stress and anxiety directly, physiologically? The answer is no. This presentation is to share with you the science and technology behind how we can address it on a physiological level and change the equation of not only addiction and recovery, but other chronic health issues that are both physical and mental health. So without further ado, I'm going to get started in my presentation. Does that sound like an interesting topic for this group?
Yes.
Like my airplanes?
Yes.
That's a T-38. I'm going to have one day.
They're beautiful.
My friend John keeps telling me if I buy it, he's going to blow it up. He doesn't want me flying. So how stress and anxiety contributes to addiction and relapse, and more importantly, what can we do about it? That's the title of today's presentation. Little background on what we're going to accomplish, what we're going to get done. Let's talk about what drives us really. Now, those of you that are in the psychological side of treatment, you're going to have a shift in understanding, an expansion in understanding what's driving us. I'm talking about what drives us on a physiological level and what we're born with. Not decisions we make in utero or as a toddler or through trauma, but rather just non-decisions that are elemental to being human. The specific stress profile of addiction. Believe it or not, there now exists a profile that starts with a predisposition and then a very likely statistical reference that somebody is going to become addicted to something, either substance or experiences, with this particular stress profile. So it's a warning ahead of time. I'm going to give you a definition of stress and how it becomes cyclic. Anybody here interested in a specific definition of stress? Yes? And then how breathing influences brain performance. Really, brain dominance is what I'm going to talk about. And then those of you that are in the psychological side, you're very familiar with high and low brain function, right? We're going to talk about how breathing has the most influential element on brain dominance of all the things that we are. Because why? Breathing is the most fundamental thing we do. We can go a week without water. We can go a month without food. Well, we can only go seconds without air, specifically oxygen. The connection between stress and addiction, very simple, actual one-sentence connection between stress and addiction. I'm going to show you what that is. And then finally, the predictions of compromised breathing. Believe it or not, just by taking one measurement of how fast a human being breathes, we can predict with a very high degree of accuracy, like a 99% degree of accuracy, how well they sleep, their proclivity to explosive emotions, how well they concentrate, and many, many other factors. And we call that, I call that a stress index. So wouldn't that be a useful tool that, on an intake for your clients, where you know what their stress condition is, and it predicts where they're going to land in what they're going to tell you? Because, let me tell you, people lie, either by omission or they don't understand or they don't know, but symptoms never, ever, ever lie. And these are all symptom-based explanations of their stress index. Okay, moving on. Now, number one, humans are designed to find pleasure, satisfaction, and fulfillment. Every single person in this room and that room, when you were little, spun around until you fell down. True?
Yeah.
Any abstainers? Okay? Every single person in this room did lots of things like that, okay, because they were fun. And fun isn't just, it's looked at as an interactive thing that we do, but it's something that we're born to seek out. It's an elemental drive, or an innate drive. Let me give you another example. Any human being that is born in any place on the planet will seek out to learn a language as soon and as fast as it can. Unless there's some kind of physiological impairment, that little being will try to learn a language if it's exposed to it. Kind of on the other side of the spectrum, any human being that's born that is not touched for a length of 6 weeks dies 100% of the time. We need touch. These elemental drives never go away. So PSF for short, this is innate drive number one. We're going to contrast that with an innate drive number two. Humans are also hardwired to avoid overwhelming stress. The specific stress profile associated with addiction, what is that? It's a guy named Stu. No, I'm just kidding. That stands for stress and trauma that is ongoing, overwhelming, and oppressive. These three words are magic words. Why are they magic? Because we have libraries now of MRI and CAT scans. While a human brain, in almost any age category by now, has ongoing stress, we know what that CAT scan is going to look like before the person even has it. Same with overwhelming stress. And the same with oppressive. But oppressive is a unique kind of stress. So these three words are almost, we could say, a poor man's CAT scan of the condition of the brain. Oppressive stress is a key one. Why? Well, we've studied what happens to a human being when they feel oppressed under the thumb of somebody or something. And what we found, an example is torture. What we found is that the brain body produces more cortisol under that situation than any other situation we've measured. Why is that important? Cortisol is one of three stress hormones: cortisol, adrenaline, norepinephrine. Cortisol, of the three, is the bad guy. It's the black hat. It's the one that causes brain cell death, causes erosion inside joint systems, causes erratic responses emotionally. When your body's in an adrenaline, you're just psyched. But when you have cortisol, that changes the equation drastically, and I'm going to show you exactly how it does that in a few moments. So those three words, let me ask it this way. Anybody here that interacts with patients, are they missing any one of those three? Raise your hand. Look around the room, there's no hands up. That's because what you're experiencing, what you're measuring in your own ways, are stress that's ongoing, overwhelming, and oppressive. Okay. Trauma. And we're going to talk about trauma's place in this. Trauma generally precedes a stress and anxiety response, but then the stress and anxiety becomes entrained and cyclic. And we'll talk about how that works. So before I go on, I'm going to draw this little... This is the ongoing, oppressive, and overwhelming stress going in one direction. It's an innate drive. We're trying to avoid this at all times. On the other hand, going in this direction is pleasure, satisfaction, and fulfillment. It is when these two elements collide that addiction is extremely likely to happen. That means it's probable. So we're going to come back to that little diagram in a few moments. Well, we're going to talk about recovery. Part of my background is in exercise physiology and kinesiology. In a laboratory setting, we have very, very specific and accurate ways to measure when a human being has recovered from a stressor of an emotional kind, a stressor of a physical nature, like exercise. And we can measure the physiology of the body with very, very high precision. So in kinesiology, we talk about recovery. And we're in the recovery environment. I just think that's an interesting similarity. But how do we know that you're recovered for sure? The answer is extremely simple. Breathing type and speed. That tells us what is happening chemically, biologically, psychologically, and a lot of other ologicallys in the human system. And we know the exact moment in time when recovery from stress or stressors occurs. So it's a law of physiology, and I use physiology in this talk because it's really the most reliable of the ologies because it unifies biology, anatomy, psychology, chemistry. It unifies them. It's the only science that we have where all of the ologies that we study, stress and anxiety and human beings, is included. We talk a lot in this community about the biology of the brain in addiction, right? Does that disclose to us what's happening in their breathing pattern? No. We need to find a way to measure and scientifically track the progression of stress, its manifestations, measure those, and then be able to test a way to know with a capital K that they have recovered from that particular stress. And this conversation is an introduction to a process that I use called the Rubenstein method, wherein it treats the stress symptoms and really the causes because it treats the breathing first. And it alters the breathing pattern. And when the breathing pattern is altered, you have an alteration, an enhancement in how that brain responds to stress. Question for everybody. Does a stressor cause stress? Yes or no?
Yes.
The answer is no. Our response to stress is what causes stress. The stress that we have all experienced in our lives is preceded by 200 milliseconds by a chemical release in the brain of the stress hormones. So we see a car accident, for example. We have a stress reaction to it. But what's happened before we have that stress reaction is that the analytics in the brain have said, have a stress reaction. And it's a chemical reaction and a set of electrical impulses in our brain before we feel the feeling. Said another way, we can't feel stress except the stress hormones are present. So, what is possible when we remove or reduce in a significant way the stress hormones? Answer, it changes the function of the brain. The seat of our emotions is, I'm going to say, primarily in the brain. Also lives in the body, but primarily in the brain. Okay. So what happens when humans don't find pleasure, satisfaction, and fulfillment, but only stress and trauma that's ongoing, oppressive, and overwhelming? The brain will see to it that we find pleasure, satisfaction, and fulfillment by some other means. This is the point of physiological predisposition to addiction. It's where these two things are beginning to collide. Believe it or not, the drive for pleasure, satisfaction, and fulfillment wins out over our aversion to stress. Then what happens? we use a chemical or an experience to fulfill on the innate drive for pleasure, satisfaction, and fulfillment. Remember, we're born with it. It never goes away. Are you with me on that? So, strangely, what's causing our addiction in a chain reaction manner is our drive for pleasure, satisfaction, and fulfillment. The chemical, whatever it is, heroin, alcohol, barbiturates, medication, whatever it is a surrogate for the real thing. Is everybody clear on that?
Yeah.
And what's causing the real thing to not be present is overwhelming, ongoing, and oppressive stress. Okay, so a little bit, some practicality here. So I want everybody to do the following exercise with me. What you're going to do is you're going to put your fist like this. So your fingers are on your palm, okay? There's a little hole there, about the size of a straw. You're going to take 2 really deep breaths, in and out, 100% in, 100% out, twice. Mark, set, go. You get the prize. Longest breath. So, question. Now just take a normal breath. In and out. What happened? Got more aware? Was it easier to take that breath?
Longer breath.
Was anybody, for anybody in here, was it harder to take a breath after you did that? Nobody had, no hands were up. What happened was, I caused the genioglossus muscle in your throat to open your throat. And by doing that, you also feel relaxed. A little bit, yes? In 2 breaths. Now, to contrast that and to show you why it's so important, I want you to take these 2 fingers, put them on either side of your windpipe, and I want you to lift your chin. Now don't press, okay? I want you to press with 1 pound on either side for 3 seconds. Go, press. Release. Who in here did not get some kind of stress reaction? Notice that. What I'm showing you is how sensitive the brain and body is to the slightest impairment of the windpipe, or the pharyngeal airway, as we call it. Why is that important? Because we're going to see in a few minutes that as we breathe in a maladaptive way or incorrectly, our windpipe shrinks in the stress response. And the brain really goes kind of crazy with this. Look how sensitive it is to just the slightest amount of pressure here. People say it's a choking response. Not true. It's a response in the brain to the impingement, even a millimeter of impingement of the airway. And what happens in 100% of your clientele, I can say that 100% because I know it's true, is that their windpipe has shrunk because of the way they breathe, causing more stress, compounding the stress that they do have. So, the type of breathing that we're talking about that's maladaptive, that's incorrect, only has 25% of our breathing capacity. So I was looking around the room at everyone as fast as I could to see if there was anybody in here who was breathing with their stomach. Do you think I found anybody? No? Some people are going to go, I take yoga, I know how to breathe. And I was watching, everybody went, okay? What happens when we breathe that way is a higher speed. And I want you to recognize that, because we're going to come back to this at the very end of this presentation. High-speed breathing is needed when you only have 25% of the capacity of your lungs to breathe with. Everybody understand that? It's a very simple math problem. If I'm only breathing with 25% of my lung power, I have to be faster to get enough air. The only problem is it doesn't actually work out that way in the chemistry of the blood and brain. Because the faster we breathe, the less oxygen we get. Quoted from Guton, the Physiology book of the planet Earth, there's an inverse relationship. This is a direct quote. There's an inverse relationship between the speed of breathing and the amount of oxygen delivered to the brain. So the answer is slower breathing causes a reversal in that relationship, and the brain is very, very oxygen hungry. The brain, my brain weighs about 1.5 pounds, maybe yours too. It's about 1 to 1.5% of our body weight. It consumes 20% of the oxygen that we breathe. So very small impairments in oxygen delivery convert into very large magnitude brain malfunctions. So what are the malfunctions? Stress and anxiety, brain fog, insomnia, stress hormones released. So when you did this, you got some stress hormones released. By the way, let's undo that. Go back to this one. Breathe. Okay, did that relieve your stress? Yes, no?
Yeah.
Better? Anybody stressed out? Okay, a little bit of lightheaded is normal. Hypoxia from doing that. That's just because, well, I won't go into the chemical reason for that. But let's compare this type. Remember, we're saying that the body recovers from stress, the brain recovers from stress in a very specific way by its breathing pattern. And this is just the first level at which we can notice this scientifically and measure it with a high degree of precision. There are other tools available to us to measure this with high degree of precision, but this is the most obvious. So you can sit across from a client, talking to them, watching them chest and shoulder breathe, and know that they don't sleep well before you look at their paperwork, before they tell you their story. And by the way, the more perturbed our sleep is, the less able the human brain is to evaluate its own sleep pattern. Isn't that amazing? The people that tell you, that are clients here, that tell you, I sleep just fine, they're not really lying. They have no clue what they're saying. Because why? Because the brain, deprived of sleep, we call this sleep debt, cannot measure its own sleep. Not my opinion. This came out in a landmark research paper that was published in November of 2014. We were looking at why do we sleep? Believe it or not, we didn't know the answer to that question scientifically beyond that we get tired. We have a circadian rhythm, awake and a sleep cycle, but we didn't know what is it that actually has to happen in sleep for us to feel refreshed from it. We didn't know that until 2014 November. Want to know the answer? A simple chemical called amyloid beta builds up in our brain, just like lactic acid does in exercise, during the day with wakefulness. Right now, all of us in the room are building amyloid beta in our waking state because we're concentrating, well, some of us are concentrating, and we're interacting and we're thinking. The purpose of sleep is to metabolize out amyloid beta from the brain. To the extent it doesn't, we have sleep debt. How did they confirm this? What they found was that this is not a new chemical. They found that all Alzheimer's, all patients with dementia, and similar disease processes have large, massive buildups of amyloid beta in the brain. So what we realized was, oh my goodness, sleep debt is causing dementia, is causing all mental illness. Now, this was profound to me because as a scientist, I never hear someone, a reputable scientist, say 100%. But I watched 5 reputable scientists that I respect look in the camera and say 100% of the time, all mental illness, all, is connected and directly a result from amyloid beta buildup in the brain. That's profound. Think of the implications of that. Does anybody in here that's in the treatment train with people going through recovery have anybody that sleeps well? Notice that. Would you guys answer me if I said, I just want to make sure.
Yeah.
Okay, all right. So the picture's changing. We're starting to see that the physiological causal mechanisms, because we're pretty good at the psychological causal mechanisms to addiction and recovery. Agreed? We understand that pretty well. But the physiology of it, not so much. At least not yet. So when we breathe with the diaphragm, everybody know what the diaphragm is? Right? That's down here. Let me just tell you, this muscle is extremely powerful. It's powerfully placed, meaning it has a lot of leverage. Okay? And what it does is it draws air in 75% better than the breathing that we do from up here, called the accessory breathers. And when we're breathing that way, look at the speed change of our breathing. It goes from 19 to 8, almost a third. And when we measure the blood, what we find is there's actually more oxygen there. When we take measurements of the interstitial fluid of the body, we find more oxygen being delivered there and to the brain cells. The results are relaxation, mental clarity, sleep, and it stops the stress hormones. So imagine for a moment, a person's in a lot of stress, they start to breathe well, and they feel better. Now that's not a new thing for anybody here. As a parent, my little girl would run around, skin her knee, cry, cry like that, right? And come over, oh, Daddy, I'd say, honey, take a deep breath. Crying stopped 100% of the time. I don't remember one time where the crying didn't stop from taking one deep breath. Now she's semi-present. Okay, now take another deep breath. How are you? I'm fine, Daddy. How did that happen? Well, the deep breath stopped the release of the hormones, or interrupted how much proclivity of the release of the hormones. And secondly, it lowered the amount of perceived pain. Cortisol, remember I said it's the black hat, it's the bad guy in hormones, stress hormones, multiplies the amount of pain that we perceive by a factor of 2. Let's put that in real life context. Let's say you have a knee pain that's level 4. Can you deal with that? Can you deal with a level 4? Now all of a sudden, you're breathing wrong, your level 4 goes to an 8. Can you deal with that? The answer is no. Although it's thought of as a subjective scale, it's now adopted in all hospitals across this nation as an objective scale. Because why? A level 8 pain in everyone, it's a little different for you than me, a little different for you than me, but a level 8 is the same as a human being to everyone. That's the onset of things start breaking apart. You can't function, your focus and concentration is gone, your ability to be yourself, gone, okay? Some of us can handle more stress than others, but your level 8 is your level 8. And a pain level of 8 causes us to change our brain function. I'm going to show you how in just a few minutes. So breathing type and speed accurately reflects brain dominance. Good breathing looks like that. That's the cortex being active. That's high brain dominant. Breathing type and speed that accurately reflects brain dominance that's bad is this. That is the limbic system of the brain. That's what's employing most of us. The limbic system of the brain. And look, did you know that there's nothing about addiction in the prefrontal cortex of the human brain? Did you know that? There's nothing in here that supports addiction. Quite the contrary. That part of the brain will not let you use a drug or misuse a drug in any way, shape, or form. It will not do it. It's its job. But when it's not there to do its job, it cannot do its job. And what you have is the cortex having low activity, the limbic area is hyperactive, low brain dominant. So what we're saying is that high-speed breathing done with the chest and shoulders causes low brain dominance. That's what I'm saying. And the only way to really get out of that is to restore proper breathing and slow it down. So in review, speed, hyper or hypo, type, chest and shoulder, causes chronic low brain dominance. And it is my opinion, so far everything I've said to you is a scientific fact backed up by lots of mountains of scientific information that's convincing. Good science, not junk science. The following, what I'm going to say, is my opinion. My opinion is that chronic low brain dominance should be a comorbidity diagnostic code that is included in the addiction and recovery business. Because that's what you're dealing with. You're dealing with people whose brain is essentially betraying them. We're not designed to function with chronic low brain dominance. There's a reason why we need to have the limbic system. Let me explain. 10,000 years ago, the tiger's running at me. I'm on the savannah. Do I A, look at the tiger and go, I like those stripes. Wow, he's really muscular. You know, he's going really fast. That's very interesting. I'm now lunch. Right? The brain needs a system to instantly activate and cause us to fight or flight for our survival. That's located in the limbic system. The rest of our brain doesn't really, we don't want it on. We don't want careful, slow thinking, as I just modeled in that little cartoonish example, because then we're lunch. So this chronic brain dominance is a potential tipping point. So we have a predisposition, now we have a tipping point. And when I share this presentation with clientele, they go, yeah, that's what happened to me. That's how it happened. It didn't just show up and boom, they're addicted to something.
Right.
There was a process. There was a trauma. There was a impact of the stress and anxiety that had a cyclic manner over time, which disabled their frontal cortex and their cerebral cortex from functioning, which leads you to bad choices. That's what's happening. And it's all monitored by breathing, and it's all created by the limbic system. Now, we're saying that breathing type and speed determines brain dominance. Brain dominance determines emotions, watch this, thinking, and behavior. Everybody in this room will behave differently when your limbic system is in charge than when your cerebral cortex is in charge. By show of hands, who's in a long-term relationship right now? Okay? Okay. So do you ever have a fight, argument? Knock down, drag out, couple of those, okay? If you think about it right now, is that two people making sense to each other in an argument? No. What it is this person A, stressed, this person B, stressed, and their stress is talking to each other. Right? That's what's happening. We're not carefully, thoughtfully working through something. We're arguing. And what I'm saying is our limbic systems are arguing, not our frontal cortex. Frontal cortex is conflict averse. Okay. So how does this happen? The hyperproduction of cortisol is creating low brain dominance. We call it a stress lobotomy, unthinking responses. We call that amygdala hijack syndrome. Everybody go like this. Take your little finger, squeeze the tip of it, just like this. Look at it with your eyes. Look at it in front of your face. That something that small completely takes over your brain during a stress and anxiety episode. That small completely takes out, like takes the knees out of, as it were, the frontal cortex. That's why there's a line in right there removing the frontal cortex. Amygdala hijack syndrome. So how does that happen? Information is fed to the thalamus. Information is sent to the amygdala. It's also sent to the cortex. Now notice this is very, very interesting. The information of our experiences gets sent to the whole brain at the same time. However, in amygdala hijack syndrome, it's the one running the show. It's blocking out all the rest of brain functions. Because why? We need that because the tiger's running at us. We don't have tigers running at us anymore. We have other stressors, more frequent and more bizarre now in today's society than back then. So the amygdala does a threat assessment, it blocks slow thinking and creates an unthinking response. That's what it does. When stress hormones are not being produced, low stress means high brain dominance. Imagine what's possible with your clients if their high brain was dominant most of the time, which is not what you experience. You have the word discernment. I think is an elegant word. It means to measure on fine levels different dimensions of information and to understand how they interact, how they are in relationship. Self-control and the all-important no button. How many people in here have been in traffic and somebody cuts you off really radically?
Yeah.
Your first reaction is, I'm going to drag that guy out of the car and beat him to death, right? You have that reaction, but you don't do it, right? Because your frontal cortex says, don't do that, it's not a good idea, you're going to go to jail. In which case, you're going to need this guy back here. Because
I have that case right now.
okay. So what you have is an amygdala hijack case. Tell the judge that. I don't think it's going to play, but... So the amygdala is passive. It does not block the cortex and or unthinking responses. Now, one of my favorite writers in his later years said this quote. I want to know who in here can guess who the writer is. He said, I'm an old man now, and I've seen a great many troubles. Most of them never happened. Mark Twain. And isn't that true for all of us? We worry and concern ourselves over stuff that never happens 80% of the time, maybe 90% of the time. Well, that worry converts itself into incorrect breathing, which converts itself into stress hormone releases, which converts itself into changing the brain from high brain dominant to low brain dominant. Okay. Stress that we can see, we'll be aware of, versus, anybody else know what's coming? 92%, don't let anybody tell you it's 90% of an iceberg that's out of below the waterline. It's 92%. The Titanic missed, we know this from the records, missed the iceberg right here. The visible iceberg. Underneath the waterline, the iceberg ripped a 130-foot hole in the steel of the ship, and it sank in 11 minutes, killing, I think, 2,000 people in water that was 33 degrees Fahrenheit. My point is it's what you don't see in the stress world that will sink your ship. Example, your clients, your patients, do not see the utter destruction wrought by their lack of sleep. They do not recognize that as a big problem. Let me give you a medical example. Do you know what the first symptom is to a heart attack? 50% of the time, the first symptom to a heart attack is death. 1 out of 2 first-time heart attacks results in death. These are national statistics, current statistics. They didn't know they were in trouble. So it's what we don't know. Let me just pose the question to you. Is something that you are unaware of more dangerous to you, or something that you are aware of more dangerous to you? In repeating that question to about 15 or 16,000 people, I have yet to get an inconsistent answer to that question. We know intuitively, intrinsically, that it's the thing that we don't know about that's going to get us. And what's getting us right now, worldwide, is the impact of stress and anxiety on our body-brain. An example, this is how stress really is pendulum breathing. It's a name I gave the following breathing pattern. Who in here has caught themselves holding their breath? Hold your hands high and let everybody look. You've never caught yourself holding your breath? Never? Okay, that means you weren't aware of it. How about you?
I wasn't aware.
Okay.
When I was in the water.
Well, that's a good reason to hold your breath. So what we do is called pendulum breathing. We hold our breath. It's usually during concentration of some kind. I will sometimes do this, I admit. I'm trying to think through something I'm writing, and I'll hold my breath for a bit. I'll go, okay, wait, get back to breathing. And what happens is your brain will force you to catch up. So you stop breathing, and your brain says, okay, you got to breathe fast. You hyperventilate. Guess what the likelihood is that you can stop that from happening? 0. It's controlled by the pons of your brain. The most basic root form of our brain. It's an autonomic reflex in our brain. So pendulum breathing, the reason I'm bringing it up to you is it's really common and nobody knows that it's hurting them. How's it hurting them? Lowering your cognitive performance, increasing the likelihood of having an exaggerated emotional response to anything. Body pain and structural issues. Now this one's a little more obvious, and I come from the arena of chronic pain, and addiction is a chronic pain of a kind. Do you agree with that? I see it as a chronic pain. It may not be specific to something, but here's what we do know. 1/3 of all addiction cases that we've tracked for the last 25 years starts with chronic pain. Taking meds or alcohol or whatever it is to deal with the pain. So body pain, now mix that with inappropriate breathing or wrong breathing. What you have is the hyperproduction of cortisol. And I'm going to show you in a few more minutes how actually damaging cortisol becomes. It's a little scary. Focus issues. One of my favorite to talk about is focus issues. Why? Because when we're breathing incorrectly, we can't focus well. When we can't focus well, it's frustrating, right? Have you ever been able to, you just couldn't focus, okay? All of your clients have this in a huge way. Anybody disagree with that? Anybody? The reason I like talking about it is because focus spins off its own stress and anxiety that's ongoing, oppressive, and overwhelming. It's something we don't think about, we don't realize. But the harder it is for us to focus, the more frustrated we become. The longer that happens, the more angry and frustrated that we become. Guess where anger and frustration are processed in the human brain? In the limbic system. Fear and anger. That's the primary emotions of the limbic system. It doesn't deal with love. It does deal with reward experiences, and we know that certain parts of the limbic system light up with the experience of love. But love also involves the frontal cortex, the parietal lobes. Okay, lastly, sleep issues. I've talked enough about this, but here's the thing about sleep debt. It's not like any other kind of debt. It's like a student loan. Anybody have a student loan? Okay, you cannot get away from that loan. I don't care what happens. This is really a fact. You can file bankruptcy on any kind of loan that there is, but you cannot file BK on sleep debt. It will follow you, track you down, and kill you for not paying it. I'm serious, it will kill you. Let me give you an example. Anybody snore in here? Okay. Do you know that snoring is now treated as a life or death medical problem? At my experiences in the last 7 years at White Memorial Medical Center as a senior instructor, my instructor, the director, he will go to a patient and he will say, and it's on their chart that they snore, he will say, listen, you're going to die. I'm not kidding. He'll say, you're going to die. Are you going to deal with your snoring? And I'm like, are you crazy? It's just an inconvenience. Now my wife, she goes like this and wakes me up. But people are dying from snoring. Here's how it happens. The snoring noise vibrates the throat here. That vibration causes, it's the cause of the plaque buildup in the carotid artery, which then breaks off from the carotid artery, goes to the brain, has a stroke, kills you, or makes it through the system, goes to the heart, gets stuck in the heart, has a heart attack, and kills you. Isn't that shocking? Snoring. And yes, stress is the root cause of snoring. Yes. Weight has been turned over as a predominant cause to snoring.
Also like allergies and asthma.
We thought it was a very reliable measure, and through body mass index studies and such. What we found over time is it's a part of the differential diagnosis, but it is not a reliable, because there's plenty of people that are overweight that don't snore.
Or tiny that do snore.
Or tiny that do snore. The key issue here, and this is what I'm going to be speaking on in a few months, is the condition of the airway. When there's blockages of the airway, this is a structural issue in the cervical spine, a structural issue in the oral cavity, and a structural issue in the pharyngeal airway, that's this part here. Those structural issues are what lead to snoring and a high incidence of death as a result. Because what happens during you know what apnea is? You stop breathing at night.
Yeah.
What happens during apnea is the heart goes bum, 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 starts beating really, really rapidly. Okay? If that heart is weakened by a pathology like heart disease, during that sudden increase of heart rate, there's a higher potential for a heart attack. So this is where people are dying in their sleep from sleep apnea. That was a big sigh over there. Okay.
So the CPAP machine addresses that narrowing.
Yes. CPAP machine, I'm going to speak on this for just a few minutes because it's such a crucial, interesting subject. Everybody knows what a CPAP machine is? Okay. It is a system that puts air into, you wear it all the way full mask, and what happens is it increases the partial pressure and forces air into your system. It expands the throat, which is a good thing, and gets air all the way into your lungs. So it's an internally powered system. The opposite is what we do with skin diving. Okay, when we go diving, we're holding our breath, or we're breathing through something that allows us to breathe. The difference between that and a CPAP or BiPAP machine is that it's forcing the air in. And it works. The problem is there's a 90% failure rate of compliance. People feel claustrophobic. So does it work? Yeah, it's the gold standard, but there's a big problem with it in that people don't want to use it. Now, the reason I want to talk about this, now that you have a background on it, is the diaphragm muscle is our CPAP machine. When the diaphragm works and is powerfully working, it's pressurizing the system. And when it pressurizes the system, the airway, guess what, stays open. I've worked with, I don't know how many cases now, it's in the thousands, of people with sleep issues, like apnea, hypopnea, or insomnia, all of those went away as a result of getting their diaphragm to pump air efficiently. So we have an internal CPAP, which works better, is more reliable, but when that doesn't work, we use a CPAP. Okay, I'm going to go through this slide to here. When we are using the diaphragm, it activates our primary systems. Our primary breather is the diaphragm. It causes relaxation. I don't think you got what I'm saying. What I'm saying is that when you breathe right, you have to relax. It's a neurochemical, mechanical, electrical chain reaction that you can't stop. When you're breathing with the accessory breathers or the secondary system, you must experience stress. Now, I know there's someone in this audience, I know you're out there, you're saying to yourself, not me. I can take a lot of stress. You're saying, I can breathe long and I can still handle it. Okay, you say that all you want. The science flat out disagrees with you and says you will manifest stress symptoms. You may block them out. You may override them with your titanic mental self. Okay? And I'm joking about this because I'm really making fun of me. I'm making fun of me because I'm a very willful child. I want things my way. I have this belief in life that everybody's a control freak of some kind in some way. Everybody agree with that?
Yeah.
And so I like to have things be the way I like to have things. And when I'm in my secondary system, I know, oh no, I'm going to pay a price for this. And my ego says, I know more, I can get out of it. And I'm lying to myself. Okay, so secondary systems produce stress. That's how it feels to me. Little sharks down there trying to scramble up I used to rock climb, so it kind of reminds me of the fear of heights. Okay, here's the definition of stress, okay? This guy's name is Johnny. Johnny is a chest and shoulder breather, okay? And he gets a phone call at noon, and the phone call is really bad news. He has an instant stress spike of an 8 on a scale of 1 to 10. Remember, that's not a subjective scale anymore. It takes Johnny, because he breathes this way, 3 to 6 hours. Some of you might not be able to see this over here. It says 3 to 6 hours to metabolize out the cortisol around the norepinephrine. 3 to 6 hours for one event. Now, Johnny came to the Rubenstein clinic and learned how to breathe diaphragmatically, and he got, the next week, he got another really bad phone call. Look at his stress response. 50% less stress response. It's now a 4, and only took 5 to 40 minutes to metabolize out the problem. Here's what clients say to me going through the process. They say, and they say it in the same way. They say, you know, this is really weird. I said, what's that? You know, I have all these stressful things, and I'm not stressed out. They are disoriented because they're used to being, we are used to being stressed out from stressful things. And when you are no longer stressed out from stressful living in a stressful environment, this is, by the way, one of the top most stressful environments to work in America, or the world. You want something more stressful? Pick up a weapon and go join the army, or be in combat, or be a firefighter or a police officer, or an emergency physician, an ER physician. Those are about the only career choices you could make that are more stressful than this environment. Therefore, everybody that's in this audience needs this treatment if you are interested in getting your stress down. Anybody in here interested in getting your stress down? How about you, sir? So this is the difference that breathing makes. And we are talking about breathing because it's the first and easiest level at which we can measure and observe stress and anxiety as a manifestation in the physical body. There are a lot of other treatments that go along with this process. They are outlined in the back of the brochure in your chair. So this is more realistic to real world. We don't have one stressor during the day. Who has one stress a day? I'm jealous.
Yeah.
I want one stress a day. But here's like what real life is. Here's a chest and shoulder breather. They wake up with a level 7 stress. How many in here wake up with a level 7 stress? Okay? Your body brain cannot sustain that. Just saying. That's what the science says. Go over here to sleep. How many of you go to sleep with a 7 or 8 stress level? Okay? When you do that, when we try to go to sleep with a 7 or 8 stress level, we don't really sleep, do we? We nod off, we wake up, we nod off, we wake up, and we're generating what? Sleep debt. Which is what? The buildup of amyloid beta. Which leads us to what?
Death.
Fatigue.
Oh, right.
Mental illness.
What is
I got diagnosed with a sleep problem as a result of a head injury about 20 years ago. And what happened was I was awake for 8 days. Didn't sleep a minute for 8 days. And I didn't know that the military keeps you awake for 3 days and you start to lose your cookies. I was certifiably insane on day 8. I'm telling you, I was hallucinating. I was seeing, it wasn't even ghosts. I was seeing people that weren't there. It was scary. So I went to the doctor and he said, you need some sleep. So he gave me some sleeping pills and went through a process and I was fine. But I was shocked. And it's shocking to, and this is how it makes you appreciate sleep debt, is when you don't get sleep for several days, you will unwind. I don't care how tough you are. So, now, in life we have traumas. Those traumas lead to the fight or flight response. Said flight or fight response leads to and causes chest and shoulder breathing. Chest and shoulder breathing causes a clenched jaw. All of your clients will complain if you ask them about tension in their jaw. And if it isn't there, you can simply palpate the masseter, and if it feels like a bone, it's in trouble. It's supposed to be soft like a muscle. A clenched jaw leads to muscle tension body-wide. The TMJ is the stress button of the human body and human brain. When we have tension there, it causes us mental tension, and we can measure in the laboratory how much body tension it actually creates. How many people here have been, you're lying in your bed, and your body's tense and you don't know why. And you can't get it to untense. Everybody's had that experience, right? Has anybody not had that experience? Okay, so we've all had that experience. Answer, check the TMJ, and you'll find that it's under tremendous pressure because it sends what's called a descending spinal tract message down our body and tenses our muscles. It does so in a way that we can't undo it until this is undone. And it's ruthless about this. This is part of the tiger running at me and now having a fight or flight response, but it's stuck in the on position. So we clench and grind our teeth, right? Right?
Yes.
So what this does is it leads to a collapse of musculoskeletal integrity. Muscles are supposed to have very specific contractile properties. Certain amount of tension over a certain amount of space, located in specific spots. When that doesn't happen, our body starts to compensate. As it compensates more and more, we get a collapse of musculoskeletal integrity. This is a posture issue that Miss Dr. Fitness, you were talking to me about earlier. Okay? That leads to joint compression. Example, this is your knee joint. There's supposed to be a very specific number of millimeters between very specific points inside the knee. When there's even a millimeter of collapse, you get rubbing. Rubbing causes deterioration of the joint. Deterioration of the joint creates inflammation. Inflammation is now the center spotlight issue in American medicine today, along with brain science, as the most difficult and powerful issues around human health that there is. we find that every single health issue that we can find a name for has inflammatory processes involved with it. Due to time, I just need to move on. That spins out body pain. Does body pain stress people out?
Yeah.
Of course it does. That leads to poor sleep. Poor sleep leads to higher stress. Now I'm chest and shoulder breathing even harder. So how do we get out of this stress cycle? Here's the answer. Oh wait. This, as you go around this circle, or this oval, what you see is that this is the delivery of oxygen does not equal the demand. Here's what I'm saying. Each point around the circle is a point that increases O2 demand. However, as that's happening, the chest and shoulder breathing is getting worse, which increases the demand more, and what you get is a graph that looks like this. The demand keeps going up, the ability to deliver keeps falling. This disparity is stress and anxiety and trauma. It is the release of stress hormones. Is that point clear for everybody in this room? Okay, so how do we get out of this stress cycle? Here's the answer. The first thing we treat is the breathing system. Why? It's the most fundamental thing we do biologically, psychologically, chemically, neurologically. We've got to treat the breathing system. Now, there's somebody in this room, I can hear him. You're saying, I can treat my own breathing system. I'm going to tell you, no you can't. No you can't. Not successfully, not significantly successfully. In my career, I've met 6 people out of 40,000 that breathe correctly. 6.
Is it the Dalai Lama?
I've treated more than 100 breathing instructors. Do you know how many of them proved out to be correct breathers? 0. They came to me with pain problems. Turns out they had dysfunctions in their diaphragm that caused their pain. How do I know? I treated their diaphragm, their pain went away. It's neck pain and low back pain. Yoga instructors, got lots of those stories. Lots and lots of them. You can breathe with your belly, in and out. You hear any air going in and out of my body? That's just the rectus abdominis in my one pack here, moving back and forth. It was a 6-pack one day ago. So when we break this cycle of stress, what we do is we start to optimize the delivery of oxygen to the demand, and we start to close this gap progressively to this, and then finally we flatten it out, and then we actually reverse it. What happens when that happens? Optimize brain function. You get smarter. How I got to be in front of this wonderful group is, it looks like an accident. I believe in divine providence, but it looked like an accident when it happened. I was using this process with chronic pain patients, and
Passing notes, dear. Trying to be sly, but.
so what happened was that a lot of people leaned forward and said to me, is this supposed to help me with addiction? After the 36th or 35th or 36th person, I said, I gotta address this. Something's happening here that I didn't plan on. I didn't plan on working with people in addiction, okay? But a third of my clientele, I later learned, were addicted to pain medications or alcohol. And they were saying to me, hey look, I don't want them anymore. What happened? And I didn't have an answer because I didn't have any education in this field at the time. Okay, I'm going to move along because we have limited time. This is very important. Is it okay if I take about another 8 minutes?
Yeah, I just want to make sure too there was time. But you guys can, whoever wants to stay and ask questions, you know, we have time afterward. I just want to make sure people who needed to leave, because we usually do like a little
Wrap up?
raffle afterward.
Okay, so is it okay if I take about another 8 minutes to get through the rest of this, because the end point of it is the cool point.
Yeah.
I'm just warming up, okay? I promise. Okay, so this is us. Most of you recognize the sympathetic or parasympathetic nervous system, okay? This is adrenaline at the top and acetylcholine at the bottom. These are the hormones that precede the experience of relaxation or excitement, okay? This is the positive versus negative emotional line. Cortisol underpins all negative emotions, and DHEA underpins all positive emotions, serotonin, dopamine. When I put these together, we're looking at the 4 quadrants of what? Innate drives or avoidances. Okay? And these 4 quadrants become very interesting when we look at them a little more closely. Quadrant 1, passion, determination, focus, inspiration. It's high brain dominant, means you're breathing well. This is performance, and it's a combination between adrenaline and DHEA. DHEA sources many hormones of pleasurable nature. Quadrant number 2, calmly satisfied. It's also high brain dominant, contentment, curiosity, peace, and reconciliation. How many like quadrant 1 and 2? Okay, everybody, right? Contentment. 20 seconds on this one word. Question, can everybody in this room right now be content with where you are and what you're doing right now?
Yes.
Okay? If I ask you the same question about can you be peaceful, I'm going to get a lot of no's. There are levels, neural reflex levels in our physiology where we can be content that leads to peace. But if you try to force peacefulness down someone's throat and they're not yet content, forget about it. The chain works in one direction. Okay, quadrant number 3. Low brain dominant, apathy, boredom, detachment, indifference. Sound familiar to anybody? Quadrant number 4, also low brain dominant, explosiveness in the emotions, anxiety, anger, drama. I love the word drama. ADD and frustration. This is stress and anxiety that's overwhelming, ongoing and oppressive. Here's the whole thing. Now, look here. Innate drives going to the right. Innate avoidances going to the left. I'm going to make a bizarre and courageous statement. There has never been a single solitary case of addiction in the history of humanity in which they were living in quadrants 1 and 2. It's a chemical impossibility. Why? Because these are driven by pleasure, satisfaction, and fulfillment. We're getting the what that we're after. It's when we're not getting the what that we're really after, that we're born to get, that we end up in quadrants 3 and 4. I often have clients draw where they see themselves. And I have yet to have anybody who's in treatment draw themselves over here. Not one. They always draw themselves over here. And most commonly they say, you know, I go from 3 to 4 and back to 3 again. Or the reverse. Okay, so what's the connection between stress and addiction? The short answer is the innate avoidances have become dominant over the innate drives. The innate avoidances have dominated over this. And this is spinning off this to find a surrogate. And then that behavior pattern becomes entrained. Okay, here's the cool part. This is called the stress index. This is a respiratory rate predictions of major symptoms. This is the short list. This list is 4 times longer than what I'm going to show you, but I'm going to keep it simple. So, chest and shoulder breathing. Breathing type, chest and shoulder, or shoulder and chest, is in the red zone. You're going to look at the other end, you're going to see diaphragm. Watch what happens. What's associated with that type of breathing is a sleep result called exhausted. When you wake up in the morning and open your eyes, the first moment you open your eyes is as good as a polysomnogram. That's a sleep study. Open your eyes, how do you feel? Your clients are telling you they're fatigued or exhausted. And the ones that are really, really bad, they're saying, I'm fine. Stress reaction, they're in overwhelm. True? Crew over here, they're in overwhelm all the time, right? Focus and concentration, extremely difficult. Watch the red category. Brain dominance, look at that. Limbic. The limbic system is dominant. And finally, the respiratory rate. 19 or above. This number right down here says N equals 11,000. This was generated from 11,000 individual measurements of the respiratory system. Different individuals. 11,000. So this makes this really reliable. Here's the thing. I don't find anybody straddling two categories. And you know what? They always want to straddle two categories. How many of your clients say they feel misunderstood? All of them, right? Do you know where that thought, I feel misunderstood, comes from? The limbic brain. We can't find it in the frontal cortex or the parietal lobe. Okay. So, quick summary. Stress is a root cause in addiction. I did not say it is the only cause. I said it is a root cause. The fight or flight response gets stuck in the on position. Breathing speed and type reflect brain dominance, which influences emotions, thinking, and behavior. Stress becomes cyclic and intractable, leading to addiction onset and relapse. Stress and anxiety is a physiological issue which can be directly treated. That is the conclusion of my presentation. I will take questions.
Thank you.
Do you work with adolescents?
Yes. Down to 5 years old. I haven't figured out the 4-year-old yet.
So in addition to your method, and you must have, I like this particular strategy.
Mm-hmm.
Do you have like quite a few then, different physical?
How many methods do I have? It's a group of methods. They're all my methods from my own research, and you could compare them to methods like Buteyko. And I'm just going to say that the numbers that I produce, the science result is superior to those other breathing methods. Because what I did as part of my research was to look very, very deeply into them mathematically, and I actually found errors in their systems through the help of my best friend who's a professor in mathematics. So yeah, it's a whole, and here's the thing, you can't learn to breathe well overnight. You have to learn it in stages with practice in between. It's the only way I can say that I know that you can learn it. Has to be done first by activating the diaphragm, then second stage is by doing what's called pause breathing. That's where you inhale, you exhale, and you pause for 1, 2, 3, 4 seconds. Okay, don't try to do this on your own without some instruction. Then the third one is called triangle breathing. That's the name I gave it, where you breathe in equal amounts, 3 seconds in, 3 seconds out, 3 seconds as a pause. And what happens is during that pause, there's a change in the blood chemistry of oxygen and carbon dioxide, and that change causes the increase of delivery of oxygen to the brain, and the brain instantly calms down. All the frenetic stuff in the brain just goes away. Next question.
Is your treatment covered by insurance?
Yes, I just found out last week there are 5 codes. I haven't used them yet. I didn't know it was covered until last week, so I'm kind of, I can say yes because I was cleared. I just haven't billed for it that way yet.